Hello viewers, we have been hearing about Nipah outbreak in India. Let us talk about what kind of infection is this and how is it spreading, what kind of preparation is required to deal with it. Nipah outbreaks is being seen in Kerala again. Number of cases have gone up to 5 and we have seen few articles recently talking about going up to 6. So number of cases are slowly rising and government agencies are keeping track of 789 people who might have exposed to this infected people, and already it has claimed 2 lives. In this context, let's know what kind of infection is Nipah viral infection. Nipah viral infection has started in 1999 in Malaysia. In a pig farm in Malaysia, this infection had begun, and we have seen later infection being spread to Bangladesh in 2001, and nearly almost every year we are seeing outbreaks from this infection. And we've also seen cases of this happening in India repeatedly. We have seen in Kerala in 2018 killing 17 people out of 18 people who got infected, who confirmed to have been infected. Is it for the first time it came to India? No, even before that we have seen cases. So this 2018 outbreak that happened in Kerala was the third such outbreak. Before that in 2001 and 2007 we have seen cases in West Bengal, killing 45 and 5 people in these 2 incidences. Later in 2019, 23-year-old student got tested positive, and later in 2021, 12-year-old boy got hospitalized and died with this infection. So it happened multiple times before. In West Bengal we have seen, in Kerala we have seen thrice. So it repeatedly coming to Kerala as we are noticing here. So what kind of virus is Nipah virus? Nipah virus is an RNA virus. Like COVID, it's an RNA virus. Of course, there are some differences between COVID virus and this, although they both carry RNA as a genetic material, and this virus causes negative strand of RNA, unlike COVID virus where positive strand of RNA is being used, meaning directly instructions in the form of RNA can be used in making proteins. That is slightly different here. And it belongs to what is called paramyxovirus. Paramyxovirus, family called paramyxovirus. Features wise, it belongs to this category of viruses. So it's an RNA virus and it's a paramyxovirus. How does this infection spreads? It is a zoonotic infection, meaning it transmits from animals to humans, specifically through what is called fruit bats, or they are known as pteropus bats. What is pteropus bats? Pteropus bats, as I mentioned, referred to as fruit bat, which eats different kinds of fruits. When a fruit bat, which is a natural reservoir, meaning it carries this virus in it and but doesn't get infected, and when it eats fruits, the saliva, the fluid from this bat may add this virus in the form of this fluid onto the fruit, and this contaminated fruit, when eaten by animals like pigs or humans, this infection spreads through this fluid. So it is mainly spreading from the body fluids of infected bats, infected animals like pigs. Is it only limited to pigs? It is not. It can happen in animals like dogs, it can happen in animals like cats, it can happen in horses, although infection spread rate seems to be high in pigs. Once it gets to humans, human to human transmission can also take place. Okay, human to human transmission, meaning humans also can spread the infection again through body fluids to the other individual. So this can come from animals to us or from humans to humans. What kind of symptoms do we normally notice? People with this infection shows fever, respiratory distress, meaning it infects lungs and causing harm to the lungs. People have breathing difficulties. People may develop symptoms like headaches, vomitings. In severe cases, this may even cause what is called encephalitis, that is inflammation to brain, leading to seizures. Seizures means fits, and it may lead to coma and eventually to death. So definitely it is causing some common symptoms like fever, and can also infect respiratory system, can cause harm to the brain, so nervous system, and thereby causing huge amount of impact, killing, they say, 40 to 75% people who get infected with this infection. Okay, right. So Next, if you see, what should we do? Do we have vaccines? Do we have treatment options for it? COVID-19 time, we have developed many efficient vaccines. Do we have such vaccines for Nipah? No, there is no vaccine as per WHO, no proven vaccine as such available to us to prevent Nipah viral spread, and we don't even have specific drugs to treat this problem. Then how do we deal with it? We can deal with, quarantining, things that we have done with COVID-19 as well. Infected persons have to be identified early enough and they have to be quarantined. They have to be placed away from other people so they're not spreading the problem. So they're being isolated. And then wearing masks because fluids can come, like secretions from the nose and mouth can spread. So wearing masks and wearing gloves, because if you're touching someone with the infection, you may be spreading the problem with the fluid. So wearing masks, wearing gloves can be, better way of stopping the spread, and washing hands regularly. So hygiene, washing hands with antibacterial soaps is proven to be effective, so that any physical contact that has been done, maybe in the medical setup, nurses, doctors who are touching the patients should wear gloves, should wear masks, and ensure that they have washed their hands properly, before touching something else. And I was telling you, fruit bats are one of the main cause here. So avoiding eating raw fruits, raw vegetables without washing them, and those fruits which are fallen on the ground, because they might have been contaminated with this kind of bats. Okay, so this is an important step to keep in mind. And then not drinking toddy brewed, toddy water, because these bats can also eat the fruits, which lead to this toddy. Okay, so avoiding consuming such toddy water is also important here. And then keeping mobility minimum, avoid spreading the virus, but by not going around, by not carrying the infection. Because although this infection can be seen, because we have seen it generally has an incubation period, you see here, which takes roughly 2 weeks, meaning the time it takes for the symptoms to show up. We call it incubation period, maybe between 1 week to 2 weeks. Sometimes, people may take even 40-45 days. So asymptomatic cases may be seen. So they may spread the infection as well. So it's very important that in the absence of these vaccines, in the absence of proper treatment, these preventive measures are highly important. Plus, of course, doctors would provide supportive care, or they call it symptomatic treatment is being given, meaning if people develop fever, giving paracetamol to them, painkillers to them may be useful. Okay, what else is important to be aware about? Although this infection is highly fatal, can cause death. We have seen in Kerala, even it caused, 17 out of 18 people died in 2018 time. So the death rate is high, but interestingly, the spread rate is low. This is referred to as R0 value. R0 value is a value that talks about replication rate, or it talks about spread of the infection. It seems to be low. If you remember, for COVID, this value is above 1. At peak, we have even seen R0 value of 5. What does it mean? It means that a person, when gets infected, he can spread the infection anywhere between 1 to 5. In this particular case, one infected person can spread the infection to 5 other people. Whereas with the Nipah virus, the R0 value is low. The R0 value is roughly 0.5, meaning every 2 people, infected people, can spread it to one another individual. So spread rate is low, but death rate is high. Okay, in a way that is bone in disguise here. So because it spreads less, but also other reason here, it is killing people who have got infected like Ebola. So spread rate will be low, but death rate is higher. So with the previous experience that Kerala government had, it looks like it is prepared to deal with this incident, and we hope that they are going to handle this well and the spread rate will be minimized. Thank you.